Okay, this is going to be the sub-Q and IM injection demonstration. I have my little skin pad right here I'm going to use, and then I have my little needle and my little alcohol prep pad and my clean gloves. So first off, I'm going to introduce myself to the patient and verify their first and last name, date of birth, and ask them if they have any allergies. I'm going to gather all my supplies and review the MAR and compare it with the doctor's orders to make sure that I have the right right patient, right time, right prescription, right dose, and yeah, I think that's it. And the right location that it needs to be administered, or right right route. That's what I meant. Okay, so I'm going to start off with the subcutaneous. I'm just going to use my little insulin syringe for this demonstration. So I'm going to pretend I've already prepared this medication. It is ready to go with, say, insulin that needs to be administered subcutaneously. Subcutaneously. And I'm going to start by, sorry, I wouldn't take this off yet. I'm going to start by prepping the area. So I've washed my hands, I've put on my clean gloves, I've got my alcohol prep pad. I'm going to start in the middle, and I'm going to go in a circular motion, moving outwards to cleanse and sterilize the area. Okay, let that dry for a minute, and then I'm going to go ahead, take my syringe. I'm going to take the skin, I'm going to pinch it, and for a subcutaneous shot, I'm going to go about a 45-degree angle into the skin, insert, and then I'm going to push down the medication in there. And then I'm going to pull out the syringe, release the skin, and I'm going to put like a little band-aid over the injection spot. Okay, then scoop up my cap, or I would put on the safety mechanism that this needle has on it. Okay, for my next demonstration, it's going to be the intramuscular shot. So I'm going to use the Z-Track method for that. So I've verified patient, dose, prescription, of course, with the doctor's orders and the MAR and stuff. It's going with the right route, and I have my injection site that the patient is comfortable with. Okay, so I've got my site. I'm going to start with, I've washed my hands, put on clean gloves. I'm going to take my little alcohol prep pad. I'm going to start in the middle, go out in a circular motion, scrubbing the area, and then I'm going to let that area dry. I'm going to I've got my medication here, remove the cap. I'm going to take my hand and I'm going to put pressure down to move the skin to one side so that I can get down in the muscle, and the subcutaneous layer will move back over to hold the medication in place, so it won't like come back out through the insertion hole of the needle and end up filtering into the subcutaneous tissue, because that is not where this medication needs to go. Okay, so I'm pushing to the side, and I'm going to insert my needle at a 90-degree angle, and I'm going to push down, and then I'm going to quickly remove the needle and release the skin at the same time. So, and the skin would pop back in place, and I can put like a little band-aid over that spot, engage my safety mechanism on my needle, which I'm not doing for this demonstration because I only have one more needle left. Okay, and then last, I'd ask the patient if they were okay, if they were comfortable, if they needed anything from me, and I would put my needle in the sharps container, dispose of my other supplies, and make sure that my patient had the call light by them so they could call me if they needed